Here at the Washington University Fertility and Reproductive Center, we provide all services.
And what's your last name?
Our program was the first to do IVF in the state of Missouri.
We've got years of experience here. We're kind, we're caring, and it goes beyond just the physicians.
Emily, how many do you want to transfer?
We strive hard to do the right thing. We try to meet the needs of our patients individually.
We'll provide ovulation induction with oral medication, ovulation induction with injectable medications, and we have the largest experience with IVF in the region.
In terms of people who don't need IVF, we do have amazing resources to treat folks who have a variety of other conditions.
If you're interested in banking sperm, egg freezing, we also provide extensive third-party services. What we do is really at the frontier of science.
We've got an amazing lab that sets us apart.
We are at the technological forefront. Depending on the cause of infertility, we will tailor the lab portion of the cycle to fit their reproductive needs.
To be current is what we try to do, and that continuously changes how we practice medicine.
What really sets us apart is just the people that we have working here. So we really have the expertise in place to really help these people on their journey to become parents.
We have 2 locations in the city. We're at the Central West End, and then we're also at Missouri Baptist. We also have dedicated nursing staff to each physician. So each physician has their own nurse. So that means every patient has their own nurse. This entire staff is along that ride with the patient.
It's nice to help families become a family or increase the size of their family.
I think we've gotten a lot better at talking about these things with people. Knowledge and awareness of infertility and how it impacts our lives has gotten better and better. We're very welcoming here, we're very private, and this is a good place to get that journey started.
We are all board certified in both obstetrics and gynecology, as well as reproductive endocrinology and infertility. It sets us apart from somebody that just claims to be an expert but doesn't have the proper training.
It was one of the few specialties where I felt like I could actually see my contribution to the patients in front of me.
What's also important is not only to be board certified, but to have people that continue to expand their knowledge and continue to know what's going on.
We see a lot of different things here. We get folks who just know we provide great care.
We have immediate access to high-risk obstetricians.
I see a lot of patients that have already done a lot of treatments that were a bit misguided. I think that if you're going to spend the time, energy, and emotion to do this, I really think it makes sense to make sure you're doing the right thing.
We take care of patients with all sorts of reproductive questions. This process is an emotional roller coaster. We do our best to make sure we're available to you.
I've had patients who've been with me for about a decade now. What's really neat about it is not only do you see their families grow, but you see how they grow personally, professionally, and it's really wonderful.
You really get to do what nurses go into nursing doing, which is to take care of the patient. To see the little ones when they are brought back into the office is fabulous.
If you're interested in being a patient here and learning more, the easiest thing is just to pick up the phone and call us, 314-286-2400. Get set up with an appointment and we can answer your questions.